Okay, good evening class. This is my recording video about the continuation of our postpartum period. So the goal of our postpartum care is to promote normal uterine involution and return to the non-pregnant state. And also it's minimize postpartum complication. Kasi we have the patient from the delivery and then down to the postpartum. We have also to promote comfort and healing of the pelvic or perineal tissues, assist in restoration of normal body function, increase understanding of physiologic and psychological changes, facilitate newborn care and self-care by the new mother, and also to promote the newborn successful integration into the family unit. We have also to support parenting skills and parent-newborn attachment, and also we have to provide effective discharge planning, including appropriate referral for home care follow-up. So our postpartum assessment is AB Bubbler or a Bubbler. So we have the corresponding mnemonics for this. So let's have to A, which is the appearance. B is for vital signs. B is for breast. U is for uterus. B is for bladder. B is for bowel. L is for lochia. E is for episiotomy or episiotomy. H is for Homan sign. E is for emotion. And lastly, the R is for the raw graph. So that is our postpartum assessment. Let's proceed for the inspection for assessment. So in the normal exhaustion, it's all having a fatigue and sleep hunger and exhaustion. In the abnormal, it is extreme exhaustion, weakness, and depression at the end of the 6 weeks. So under the abnormal is the pallor, anxiousness, restlessness, dizziness, and fainting. So as your responsibility, you have to give a health teaching about hygiene like bathing, change of gown, comb hair, and allow to rest and sleep. Oral care, offer food, also what she wants. So this is the appearance. So let's proceed to the V. So under the vital sign, we have also the BP. So in the normal state, the BP should be within the normal into 120 to 80 or to 130 to 90 during the pregnancy. So in the alteration, if the patient is having high blood pressure or elevate of 30 systolic and 50 mmHg of the diastolic from the baseline. Hypotension of 15 mmHg and for the systolic and 10 mmHg for the diastolic. So your nursing responsibility is to evaluate history of pre-existing disorder and check for other signs of preeclampsia. In the pulse, you have the normal, it's 80 to 90. In alteration, if the patient is having a tachypnea, a tachycardia, bradycardia, and weak threat. So the evaluation for other signs of hemorrhage. So under for the B also for the vital signs, you have the respiration, which is the normal, and then in the alteration, we have the marked tachypnea, less than 12 cycle per minute. So your nursing responsibility is to assess for other signs of respiratory disorder or the patient is distressed. In the temperature, the first 24 hours, the temperature is 36.2 to 38 Celsius. Occasionally, the patient will have a febrile on 3rd and 4th day. But if it is altered 38 or above more than 28 hours after birth, suggests for infection. So as a student nurse, or as our nursing responsibility, is to assess for the sign of infection and also always notify the physician. In our other B, after the vital signs, we have our breast. For our observation, we have the smooth, even pigmentation. One may appear larger than the other. So in an alteration, the reddened area and pain, purulent discharges or mastitis. So you have to assess for further signs of infection, redness, pain, inflammation, and discharges. Upon in the assessment and palpation, our breast is normal, soft, warm, small amount of colostrum, feeling full or engorged. But in the alteration, there have a palpable mass, or other term as mastitis. You may assess for other signs of infection. So if black duck, considered heat, massage position, changes of for breast, change a position change for breastfeeding, and then report for mastitis to the physician. So in RU, the uterus, upon palpation, the fundus is firm and contracted. So always the uterus is contracted so that to prevent from bleeding. Kasi if not contracted, it prone to bleeding, lead to the hemorrhage. And locate at midline following affected process of evolution. So the fundus of the mother is contracted when massage is stopped. So it located at the level of umbilicus on your 24 hours after birth. In alteration, it is baggy or uncontracted or difficult to locate. Fundus becomes smooth, soft, and uncontracted when massage is stopped. So above the umbilicus or displayed from the midline. In nursing responsibility, support lower uterine segment, massage until firm. So you may massage the fundus so that the fundus will, or the uterus will be contracted. Continue to support lower uterine segment and then apply pressure to the fundus to express clot. So apply ice to the hypogastric area. So some of the facilities use ice pack so that it could contract when the uterus will be contracted, and also assess bladder elimination. If it can ambulate, assist to urinate. If unable to void, refer for catheterization. So this is the bladder and this is the fundus. So you may locate it if saan siya naging firm or contracted. So upon checking for your bladder, inspect. So the normal after delivery is 4 to 6 hours ang kanyang voided, or dapat may urine output na siya after delivery 4 to 6 hours. But in the alteration, if inability to void more than 10 hours postpartum, so there have a urinary retention, and always refer to your physician. So if ever that happen, your nursing responsibility is turn on the laboratory faucet and allow patient to void. So that the patient will hear the water flow, so it can lead to her to void. If not, if there's have a urinary retention, you may also palpation. So if alteration, palpable as hard and firm the bladder, and allow to void, turn on faucet always, and allow to listen to running water. If you do this nursing responsibility and wala siyang nangyari, you may ask for you may refer to the physician, and the physician will order for catheterization. So under to the percussion, in the alteration, it is a resonant sound. So under the bowel, upon auscultation, In the normal, it should have a normal bowel movement by second or third day after birth. But in alteration, inability to pass stool or small amount of stool. So as nursing responsibility, encourage to fluid intake, encourage ambulation, regulate in diet, sit bath to promote healing of perineum, avoid ignoring the urge to defecate. So always, if patient is having the urge to defecate, tell them that they may go to the CR. Then obtain order for stool softener. So under your postpartum assessment, which is your lochia, so your lochia, you may inspect. So what's the three type of lochia? Which is you have your rubra, your serosa, and your alba. When you say your rubra, it's day 1 to 3. Your serosa is day 4 to 10, and your alba is day 10 to 14. So in alteration, under the lochia, you have your large clot, saturated perineal pads, poor uterine contraction, and foul odors or infection. So, you may assess for firmness, express additional clot, begin peripad count. So, you may ask the mother if how many pads are she using after delivery. In 4 to 10 days, the alteration is failure to progress normally and recurrent reddish color. So, you have to assess further signs of infection. So, report to the physician for immediate intervention. And also in the alba, continuing discharges prompt the doctor and referral for immediate referral or management. So this is the 3 types of lochia. We have the rubra, serosa, and the alba. So in RE is the episiotomy. So we have to inspect. So the redness, edema, bruises on perineum is normal. But in the alteration, it has hematoma or bulbar hematoma. So you may assess length of episiotomy and apply ice pack for the first 24 hours. And also give analgesic as ordered. Slight separation of wound edges. In the alteration is gapping up wound about 1 to 2 inch. Then immediate referral to the physician. We have also the small laceration. We have also the alteration is the large laceration and purulent discharges infection. Then encourage sit bath, rendered perineal care, teach appropriate whipping technique. And also in our human sign, so we have to palpate the positive findings. For if the positive findings siya, we have the thrombophlebitis. You may report to the physician for the further evaluation. Under our emotional phases of puerperium, we have also the phases which is the taking in phase, which is the woman is passive and dependent, prepare talking about pregnancy, labor, and delivery, uncertain and caring for newborn. Energies are focused on bodily concern. Uninterrupted sleep is important. Additional nourishment is necessary and happen 1 to 2 days after delivery. Under our taking hold phase, the woman begin to initiate action to her baby. So interested na siya to take care of her baby. So there have changing diaper, what do you call it? Changing diaper, and also we have also feeding the baby, and then assert independence. Mother focusing on the regained control over her body function, and then bowel and bladder strength and endurance. It happens 2 to 4 days after delivery. We have also for our letting go phase, which is give up old rules as a single, and then ready for the new role as a mother. In this phase, the mother will initiate her role as a mother to her newborn. We have also the postpartum blues, depression, and psychosis. So you may have some news, heard some news that last day I heard some news that 2 years old and also a month old baby killed by her mother. So this is a sad news because this is have some kind, a mother has an depression, and the people around to the mother is not quite not knowledgeable about the mother depression. So it's comparing postpartum blues and depression and psychosis. So under here we have the postpartum blues. It happens to 1 to 10 days after birth. But if exceed for another month or progress to another one, the patient suffer with postpartum depression, which is the mother is experiencing 1 to 12 months after birth. But within first year after birth or a year, the mother will have the postpartum psychosis. So under the 1 to 10 days after birth, the symptoms that is sadness, tear, because the mother is adjusting to the old rule to the new rule. Incidents happen only for the 70% of all births. And then probable the etiology is probable hormone changes and stress of life changes kasi with the new rule. So the therapy here is to support and empathy to the mother. Also, as a nursing rule, offer compassion and understanding. Under the postpartum depression, the symptoms here is anxiety, feeling loss, and sadness. So, nag-tense na ang kanyang symptoms. But this incident is only 10% of all births. History of previous depression, if the patient is having a previous depression, hormonal response, and lack of social support. And also, the therapy for this is counseling and drug therapy. And also referring for counseling. So, it need a therapy na for this postpartum depression. So, I think yung news the news that I heard yesterday, a day before, is that the mother is experiencing postpartum depression because she has 9 months old baby, I think. And it's under 1 to 12 months after birth. Under the postpartum psychosis, within first year, so 1 year up. So the symptom of this is delusion and hallucination of harming infant or self. So I think if he has the history before of it leading to this delusion and hallucination, harming infant or self. So some kind the news that I heard yesterday or other is that fall also here on the postpartum psychosis, because the symptom is harming infant or self, but she killed her 2 children. The first, the incident for this is only 1 to 2% of all birth. Possible activation of previous mental illness and hormonal changes, family history of bipolar disorder, or the drug for this or the therapy for this is psychotherapy and drug therapy. And also your nursing role is to refer for psychiatric care or safeguarding mother from injury to self or to the newborn. Okay, so that news, I think it falls for this both. So we don't know the assessment or the history of the mother, but in all the news, she has a 9 years old and a 2 years old or some kind that, and she killed it. So the postpartum depression, many mothers express a letdown feeling after giving birth related to the magnitude of the birth, experiencing and doubt about the ability to cope effectively with the demands of childbearing. Yes, after delivery, you have exhaustion, parang wala nang tulog. So you feel all the burden, the stress. So some of the mother is falls to the postpartum depression. So this depression is mild and transient. So it's beginning to 2 to 3 days after the delivery and resolving to 1 to 2 weeks. But if lasted for a month or a year, so iba na siya. It falls to psychiatric and depression. So in the RH or the R on the postpartum assessment is the RH negative. So example, if the female is negative and then the male is positive, their baby, they have a baby which the component of the baby is positive. So after the cell from the Rh positive fetus enter the woman's bloodstream, it will have a sensitized antibodies. So magki-create ng body ng lalabas man yung positive sa body, magki-create ni si body ng antibodies to the positive. So if naka-create na siya ng positive, it can lead to kill the fetus kasi papasok ang kanyang antibodies to the fetus and then killed all the positive. So kaya if this happen, if the mother is negative and the father is positive, you will check for your doctor or your OB, and the OB will give you a Rogram, so the immunoglobulin human. So this one is antibodies to prevent your fetus to attack from the mother's antibodies. So it can prevent, so i-prevent niya ang iyong fetus from attacking from the antibodies of the red blood cells of the mother. So ganun. So let's more explanation. If si mother negative, si father positive, and then if they have a baby, ang baby nila having a positive RH, and then the mother is negative, lalabas yung positive na RH doon sa bloodstream ni mother, and then the bloodstream of mother recognize na may positive pala dito na na RH. So immediately magbibigay siya ng antibodies to fight the RH positive in the blood cell. So if that happen, papasok siya doon sa fetus to attack the fetal red blood cells, and it can lead to death to your fetus. So the doctor will order a Rogram so that to prevent the baby from attacking with the antibodies of the mother. Okay? So yan. So our postpartum health teaching is self-care, infant care, resumption of intercourse, postpartum exercise, and their danger signs to be reported. So in our self-care, we have to emphasize importance of thorough hand washing before touching breast and after changing of diaper. So emphasize talaga natin kasi yung baby is to latch the mother's breast. Breast care for lactating mothers is avoid soap, and then encourage to obtain adequate sleep and frequent rest period. Teach proper perineal hygiene, and then encourage boiling and monitor intake and output. Teach way to prevent constipation kasi it can happen if the patient is constipated and then if she has episiotomy, masakit yun. May tahi pa si patient tapos nag-constipate pa siya. In the infant care, you have to attend to infant needs. The diaper, changing of diaper, the feeding, response promptly to the feeding cues. So, will not spoil the child. Hindi naman siya porket iiyak si baby, ano muna na siya, ikarga mo tapos painumin ng mother. It not lead to spoil on the child. But, it as cue nga nagugutom si baby. Oh, she has a needs like changing diaper. Teach proper bathing of the infant para hindi madaling maano si baby. And how to carry the baby, and then provide cord care. So, para yung umbilical cord ni baby is to dry and hindi mabaho. Teach on proper diaper changes. So, diba, if you have your diaper, hindi natin pwede takpan ang kanyang cord. So, in resumption of intercourse, so discourage until 6 weeks. 6 weeks postpartum. So, dapat 6 weeks after delivery, the postpartum. Check with physician to prevent infection and maximize healing. Coitus is safe when lochia has transitioned to alba and episiotomy, if present, is healed. So, ito ang safe pag nasa alba state na si lochia. And yung episiotomy is healed na hindi yung hindi pa healed. Kasi there are one incident na transfer from SPMC to San Pedro kasi daw na tanggal yung tahi niya. But some of the nurses said na hindi siya natanggal. Parang naganito sila. They have their coitus. So warn that she may experience discomfort. So due to hormonal imbalance, which makes vaginal cells not as thick as before. Then may use lubricating gel or contraceptive form. So in our resumption of intercourse, we have also the contraceptive methods. So we have to use the calendar or rhythm method, withdrawal method, lactation amenorrheal method, the standard days method, cervical mucus billing method, the basal body temperature, the symptoms thermal method, and the hormonal contraceptive method. So under the calendar rhythm method, we have to observe the cycle for 6 months, if regular. What do you mean by regular? Dapat 28 days cycle siya. Hindi pwede 31 ngayon, next month is 30, next month is 27. Hindi. So, dapat 28 siya. Then, find the shortest and longest cycle. Then, subtract 18 from the shortest cycle. So, 11 from the longest sexual intercourse from result of shortest up to longest cycle. So, here, we have the infertile. So, example, if you have your menstruation on your day 1, so you may count to 7 days. After 7 days, on your day 8, you are fertile until your day 19. And then your 20, infertility to your day 32. And then your menstruation again. So with this one is your safe coitus, and this one is unsafe. Okay, your first menstrual up to 7 days, and your day 8 on your after menstrual period is unsafe until 19, and then your 20 to 32 is your safe. So, here kayo having your intercourse. So in the withdrawal method also is taking outward the penis from the vagina before ejaculation. So it has a coitus interruptus or pulling out. After the if you have to having your coitus or intercourse, so if the male is having the urge to ejaculate, so he will pull out his penis and then ejaculate outside the vagina. Okay, here this one. Then and then the male will, the mind of the male after for the penetration and then the urge to ejaculate, he will exit his penis to the vagina. Yes, one. Okay. So in the lactation amenorrhea method also, it's a use of breastfeeding as temporary introductory postpartum phase method of postponing pregnancy. Based on normal physiology and infant suckling suppression ovulation. So we have also 3 months after birth. So safety is safe to have a coitus or intercourse. So we have also standard days method. So all users with men's cycle between 36 and 30 days are concealed to obtain from intercourse on day 8 and 9 to avoid pregnancy. So the color code cycle beads mark fertile and unfertile days. So this one. So we have the color white. So white leads to pregnancy is most likely. When you have your red, this one, it's first day of your period. And then this one is the day, next day, second day, third day. And then the dark brown beads, your cycle is shorter than 26 days. And then brown beads pregnancy is very unlikely. Okay, so this is like some kind of calendar method. So we have also the cervical mucus billing method. So observation of wet and dry sensation in the vulva. If fertile, if mucus is wet and slippery and clear. If non-fertile, fertile is feeling of dryness, no secretion of mucus. So these are the example. This one is not fertile, it's dry, thick, creamy-like, sticky, it's not fertile, cloudy or stretchy, semi-fertile. And this one is watery, stretchy, egg white, most fertile. So hindi siya mabibreak if you expand your finger. We have also the basal body temperature. Identify fertile and infertile period by taking and recording rise in body temperature. If the temperature rises during ovulation, so you may monitor your basal body temperature for 1 month, for 3 months to 6 months. So if the ovulation is up, you will having your temperature is high. If your temperature is high, you are mostly experiencing ovulation. So the symptoms thermal method, so it uses combination of observation of BBT or the basal body temperature and other signs, special changes in the quality of cervical mucus to identify onset of fertile period. So it's like your temperature, the sticky of your mucus, and then your calendar method. So this is the combination. And then the last is the hormonal contraceptive. It's a combined oral contraceptive, the progestin only because the mother is breastfeeding, transdermal contraceptive pills, and depot medrocyprogesterone or acetate. So this one is like hormonal methods like pills, patch, ring, implant, shot, or the depot. And the non-hormonal method, which is the condoms, spermicide, and IUD. So this is used for the male and the female. The female here is the IUD. Ilagay siya doon sa ovary, parang T-shape siya. And then if may sperm na dadating, papatayin ni IUD. And this is used as non-hormonal method. It's like this one. This is the IUD, the T-shape. The hormonal IUD, the copper IUD. This one is the condom, diaphragm, other cervical cup, internal condom, yan. And then we have also the postpartum exercise. We have the abdominal breathing exercise, maybe started on the first day after birth to help strengthening abdominal muscle. We have also the chin to chest, so excellent for second day, help develop strong back and strong abdominal muscle. We have also the perineal contraction to be added on third day on your postpartum. So hindi mo lahat isabay in first day. Slowly. And the arm raising on the fourth day to help both breast and help tighten an arm muscle. We have also the abdominal crunches, advisable to wait until the 10 to 12 days after birth. So we have also the danger sign to be reported. It's common on postpartum complication. So we will say, natapos naman ako ng anak, bakit marami akong complication? So this is the one to monitor to the patient. So that's why the patient has a follow-up check-up after delivery. So the first one is the hemorrhage, which is the blood loss more than 50 cc. So if that happen, immediately refer the patient to the nearest hospital. So we have also the early postpartum hemorrhage. We have the uterine atony. So it relaxes our baggy uterus, meaning hindi nag-contract yung uterus. So it can cause the large baby, cesarean birth, placenta accident, and dystocia. We have also the laceration. We have the cervix, the vagina, labia, and perineum. If na-lacerate sila, natanggal sila sa tahi, the episiotomy, tapos nag-episiotomy, and then na-lacerate. Yan. We have also the late postpartum hemorrhage, which is the retained placenta fragment. So sometimes the doctor is not the doctor always check the placenta fragments kasi it can lead to bleeding and harmful to the body and can cause hemorrhage. Yan. This is the hematoma. So the nursing intervention, we have the monitor fundus frequently, massage the uterus, apply ice pack in the abdomen, empty the bladder, regulate the IVF as ordered, administer oxytocin agent, initiate breastfeeding because this is the one to help contract the uterus. Monitor BS and watch for indication of hypovolemic shock. Prepare and assist for repair of laceration, removal of fragments, or evaluation of hematoma. And then emotional support. In our postpartum infection, we have to inspect the perineum. So, upon the inspection, if there have pain, heat, feeling of pressure in the perineum, there have been the patient is experiencing inflammation and redness. So remove the suture, drain, and resuture. Okay. Hot seat bath or warm compress, very light. So in the endometritis infection of the lining of the uterus, the abdominal tenderness, uterine atony, dark brown, foul smell of the lochia for the discharges. And management is oxytocin in Fowler position. The mastitis also, the postpartum infection for the breast, discharges of the breast. Parang may pus na discharges seabreast. So the source of infection, we have the endogenous, the primary for the normal flora, exogenous source from the hospital personnel or excessive obstetric manipulation or break in aseptic technique, coitus in late pregnancy, or the PROM. The thrombophlebitis also is the sign and symptom is pain, stiffness, redness, and swelling, fever, and chill. And also the positive Homan sign. How do we check our positive Homan sign on our feet? We have to flex our feet. And then if this is a pain, the patient is having a positive of Homan sign. So the management is bed rest, elevate affected part of feet, and then analgesic, anticoagulant. Avoid frequent mobilization and massage. Thrombolytic agent. Okay, that's the end of my discussion. I hope that you understand and listen for my video. So if you have question, kindly message me or PM me so that I can answer your question. So thank you and goodbye.